Okay, ethics. This is going to kind of obviously tie into what we were doing last class here when we were talking about legal. Because somehow legal and ethics come together. I don't know how exactly some days, but what is ethics?
Society standards
or
group office guidelines.
It's a group of people, what's the group for
Kind
them?
of what a group, kind of more or less decides. So we're going to talk about what are ethics, where do they come from, what are the principles revolving around ethical conflicts and special ethical issues facing paramedics today. So understand these are rules or standards that govern the conduct of a particular group or profession. So obviously our ethics is obviously one's patient advocacy. We're here to take care of patients, right? So a lot of this is gone down through an early ancient Greece from the Hippocratic Oath. Obviously, since being EMS, we're built off medical ethics. So the problem is that when we start getting new toys and having to do new drugs and research, we kind of start blurring those ethical lines. We were talking about last class about, well, how do we test some of these drugs, on emergent patients that are not conscious? Is that really ethical or not? How do we find out where's that? Is there a line or is there not a line, or do we just kind of have just say, hey, we're taking one for the team, or they're taking one for the team, and then kind of go from there.
Just make it up as we go along, I guess.
Well, it's just, well, sometimes it is. Just remember, EMT students are watching you. So, as society progresses, like I said, I'm taking a little bit of side note on ethics. What about, see people playing around on Facebook? A lot of this actually, the whole issue with Facebook started probably about a year ago, maybe a year and a half ago, where there was a teacher out east that was complaining about her students. She was venting out about her students. The question is, it turned into this big old thing, she shouldn't be doing this, is it? And they're like, well, no, she has the right to kind of, say what she wants. Where's that ethical line of her being a teacher and her still being a human being expressing herself, kind of a thing? And actually, it was about 6 months later after that, a guy at AMR, he actually got fired, and he actually go fighting for his job because he was complaining about management on social media. Now, is that ethical for work to intervene like that, or is it ethical to be complaining like that openly? We all complain. You see where it kind of gets, where's that ethical? What's acceptable, what's not at that point? So anyway, morals, we're talking about social, religious, and personal standards of right and wrong. So what I can see, generally we all kind of share groundwork of what is right and wrong, and we usually have laws that kind of dictate, say, well, this is acceptable, this is not, but there's a little more finer points of right and wrong. People can go back and forth, is abortion right or wrong? Now, they could go down to a religious belief or social, however you want to look at it. Some ethics and morals overlap. So, and like I said, morals and right and wrong often influence our ethical behavior. So, obviously, if you have no regard of, being disrespectful to patients who are, homeless, for example, I'm just kind of throwing that out there, you're probably going to be, you're not going to think twice, but you're just going to do it, right? And that's so. Well, what about the actual profession, the ethics of the profession? How are we supposed to approach that? That's almost kind of where it kind of overlaps, but kind of conflicts at the same time. When it actually overlaps and works together, then hey, we're okay. Morals often shape our legal views. Obviously, how are laws enacted? But people come in and say, well, we want this law enacted. The more majority they can get, the more the push they get the law enacted. The laws can change how often throughout many years. In fact, I remember at one time there was actually I took a criminology class a long time ago, and they were talking about what would constitute the death penalty and what would not constitute the death penalty. And one of the things they talk about, the big ones like treason, or some of the other ones, subterfuge, and of all the ironic things, man stealing. Stealing a married man, woman stealing, was actually subject to the death penalty. So obviously that wouldn't be the case now, but again, like I said, time goes by, things change as we start kicking out laws and so forth. Actually, what you see what happens with Texas, they never actually revise the actual constitution or state laws, and everything gets built, and that's how a lot of these loopholes get found because they found something happened so many odd years ago. Well, that law is still legal, and this law is illegal. You know, they never close that gap. It's like, well, we can let these people go, or let this, crime, or however you want to look at it, be committed, and then they got to figure out how to close it up later after the fact. So the fundamental question, what is best for the patient? Based on what and whose standards?
The ethics of the profession.
Who decides that, though? Who's going to decide what's good, what we call patient advocacy and not? Who decides that?
The patient.
Us?
Yeah, people higher up than like NAMT and physicians and people high on the food chain. That really is what it comes down to. They sit there and say, well, what is the ethical ideal way to determine to deal with this problem? So, who's the ideal person to determine? Who is the ideal person to determine what is best? Huh?
Patient.
What's for patient patient advocacy is going to be very different from patient to patient to patient. So what about for our profession? Do they determine what's? Because you talk to some people, they're going to sit there and say, no, every time you come here, you're supposed to come here and make me a sandwich. You're supposed to give me drugs and leave. I've had that happen. One guy actually tried to sit there and say, you understand, he started throwing this commander's name at me. He's like, I talked to Commander such and such, and you're supposed to give me morphine, and that's it. And then I'm like, no. But, so, who decides what's going to be, ethical for us? Those are things you got to kind of look at as the years go by, and just if you guys start moving up in management and things like that, that's people that are going to look at. Well, you've done this for X amount of years, what should we be doing? So what other persons groups may play in the role in the decision-making process? Large organizations, like NAMT could be one, National Registry could be another.
State.
State could be doing it. The Medical Society of Texas.
Couldn't just the number of street medics or EMTs, just if enough people voice their opinion on something, maybe influence the higher ups to maybe change the way they think?
It could. And a lot of times that happens. The problem where that fails, it's usually the approach. If you ever look at the complaints of what usually field crews have, management ethically or management-wise to upper management, it's usually pretty legit. It's just how they interact with each other is what causes the problem. Anyway, ethical considerations. It's always good to know terms, right? So, primum nocere, first do no harm. Benefits, doing what's good for the patient. Non-maleficence, the patient's paramedic's responsibility to not harm the patient. Autonomy, the patient's right for self-determination. Remember that whole civil liberties thing we talked about last class? And justice, treating all patients fairly. We're not going to hold one medication to one group versus the other. We're not going to treat one group of people or populace or disease populace differently than from other people. We want to treat everybody the same. Okay, revolving ethical dilemmas within healthcare community. Okay, professional accountability. How do we do that? We can be accountable for you with, for example, like if you don't fill out so many fields in a run form, or you don't get this much billing information, or you don't make, you're not leaving the hospital in X amount of time. But how do we hold you accountable ethically?
We are following the standards and the protocols. That's what we're held to. We get training.
Can you follow the standards and protocols and still be unethical?
Mm-hmm. Yeah.
Good example was, and I remember we got RSI years ago in Colorado, and for some odd reason, there was this one medic, he was RSIing people like just about every week. Now, with all the paperwork, everything looked legit. Was he being ethical though? Were these really situations that truly warranted, you know, hey, I'm going to snow you out and paralyze you and put a tube in you? Or is somebody just taking advantage of a new toy or new skill? That's where it gets tough. Because like I said, that's where the ethical people can, you know, like I said, if they're smart, they're going to look for ways around it. They're going to look for ways around it, and you might even get their attention, but they're like, hey, I know I've already got the system in place, so.
Would that be too, like, say you run on an accident and somebody really needs to go, and they're like, well, you're not strapping me to a backboard. You're not doing it. Okay, well, I won't, you know, you should be, but you really need to go to the hospital, so I won't backboard you just to get you to the hospital, you know?
How's that? What's the...
Like, you know, they're like, if you backboard me, I'm not going to go to the hospital.
Yeah.
Well, you really need to be backboard. You explain it to them, and then you're like, you know what? You know, you need a surgeon or whatever. We'll take you on the stretcher. You know the consequences of your decision as opposed to forcing them on a backboard.
You can't make them do something against their will. That's that whole patient autonomy, right? So I have the right to determine what's going to happen to me. You know, the other thing is is that unethical? I mean, you're not withholding treatment, are you? You know, and what you're doing best for patients, getting them to the hospital because what they really need, especially if they might need a surgeon or getting CT scans or X-rays. You know, sometimes that's what you have to do. You know, you can't. You cross those lines. I mean, I've seen some places where, you know, people, they're like, no, they're forcing them down the backboard, you should have done this, or they tell them they should have done that. It's like, no, you can't. That turns into a whole issue of assault, battery, and everything else, and it's like, is that really ethical behavior to take away somebody's rights?
I know a lot of times, like you do, like in a situation like that, you get to the hospital and doctor's like, why didn't you backboard them? Well, they said they didn't want to be back. Well, they should have been backboarded. Well, I agree with you, but
I've run into that, and I said, well, and I've told them blankly, well, there's this thing called civil liberties, and I cannot violate those. It doesn't matter. You know, you cannot. That's one of the things you know, I mean, I've seen that happen of, you know, like, well, yeah, this person was, you know, drinking, therefore they're obviously intoxicated, we're going to take it to the hospital. Now, a lot of us could probably sit here, have a few beers, and we'll be very oriented. Does that constitute us unable to make decisions? You know, but like I said, you know, the flip side, let's say more of an unethical behavior would be like, well, I can sit there and say, you know, come to this conclusion because you've got this intoxicant in your system, therefore you can't make a decision. No, I've just been drinking. Doesn't mean I'm intoxicated yet. I've just got alcohol floating around. So, but like I said, that's you got to be, you know, like I said, that kind of unethics is what we're talking about. They're blurring that line to liability, and liability is something you really want to avoid. You know, good ethics, good medicine avoids liability. You know, people like that, some say, oh yeah, you're supposed to do this, or I'll send you, like, you know, I've gotten in an argument, you know, I remember having a commander tell me, he's like, there's only one drug a patient can refuse treatment from, and that was, you know, giving sugar. Technically, no. You can sit there, somebody can have chest pain, you can give them a whole bunch of nitro, aspirin, and morphine. If they say, hey, I'm done, they're oriented, they know what's going on, they sign the paperwork. You know, if they want to go so far as to talk to the doc on med control, da-da-da-da-da. Technically, no, you can't kidnap them. So you got to be, like I said, that's, I know, and ideally, yes, we'd want to take them in, that'd be in their best interest, but like I said, careful making a good deed turn into a bad one. Yeah. But yeah, that's like I said, you got to remember the patients do have rights. Patients do have rights, So establish some norms of care. You know, like I said, ideally it's just, you know, we kind of sit there and say, well, how do we want our paramedics to function? How do we want them to present themselves? You know, how do we want them to be looked at in the community and so forth? Research, treatment, and protocols. Obviously, we want, you know, any treatment that we do, we want it to be humane. You know, and obviously, if it has to be truly invasive, we don't want it to be obviously completely scarring. Or, you know, obviously, when we have to do a crike, that's going to leave a scar. We just hatching away, hoping for the best, right? So, perspective and retrospective views on decisions. You know, it's kind of easy. Well, what do we think will happen? Then we look back and say, well, it actually did happen. And sometimes, like I said, it seems like a good idea. You have to actually put it in play and see. It's like, oh wait, this is not working. We got to stop this now. So understand within the public, like I said, patient bill of rights. Do you want to go look at patient bill of rights? I mean, there's a long list. I mean, again, when you see something like this, something had to happen to sit there and say, wait a minute, there's a group out there who will violate your rights or the patient's rights, that we had to do this. And that's what's kind of scary when you think about that. It's like there's some practitioner out there that maybe has, you know, MD, DO, PM, RN, or whatever after their name, LP, and they did something, or doing something, and said, you know what, we need to make it very clear these people have rights. And of course, advance directives make to the patient's wishes. You know, obviously, like I said, you know, somebody's got an advance directive or DNR, and they say scrap it. You know, again, like I said, they have those rights. So principles for resolving ethical conflicts. Usually, one way to do is a long approach. You know, it's kind of more of a universal form. We kind of look at the implication consequences, compare relevant values. Again, this is very long. You know, accept, reject, you know, kind of modify. Usually we're going to kind of focus more on the quick approach, right? So we find things, you know, similar problems. Is there, you know, postpone? Do we need to postpone a decision? You know, sometimes some of those policies that are enacted, you know, I mean, conduct policies. Do we need to just sit there and say, well, yeah, we got a couple crews that were, you know, acting like screwballs, and we need to hammer the whole system and say we want this kind of ethical standard right away? Or it's like, well, wait a minute, maybe this is just an isolated event, or maybe enforcing this kind of conduct code is actually going to cause more problems for us in the long run. So anyway, they got a couple quick tests for it. So, is this type of ethical problem for which you have already worked out a rule? Okay, here's one for you. Eating at Chili's at the bar while you're on duty. Or actually, at Chili's, they serve alcohol there. Is that an ethical issue, you think?
Yes.
Yeah? But you're not drinking.
But
You're saying no?
You're surrounded by
Is this
the
not a
environment.
problem?
Mhm.
Yes.
It is a problem.
No,
Why is it a
it's not
problem?
No, it's not.
You're surrounded by the environment.
Could be a problem. I mean,
How wasn't it, who says it is a problem to be doing that? Be eating like at Chili's or something?
Or to just go to a
Or
place.
how about this one? Here's a good one. This is what we ran into. You know, paramedic crew is found eating at Hooters. You're eating a hamburger at Hooters. Is that is that a big? Should that be an issue?
Yeah.
Why?
perspective reality. I mean,
They're just
somebody driving by, how do they know they're not in there flirt? You know, they see a Williamson County ambulance out there. How do they know they're not there flirting with?
How do you know they're not?
How do you know
You just don't. You don't know.
Yeah.
You just
So
It just looks. I mean, it just looks bad.
yeah, it's one way of looking at it. But I mean,
somebody can take a picture of you, put it on Facebook or
Maybe
something.
just
that's just for you. That's just gonna be, you're going to be on that Facebook too. You know, the newspaper. You know, but
Hamburger logo.
yeah, you'll be sitting there looking outside, and there'll be having to be a shooting girl that'll be right in the frame, and they're like, "Yeah, look what this guy's doing there." But which can actually very well happen. I mean, you're just kind of looking over there at something else, at the traffic. They're thinking, "Oh yeah, you're obviously looking at the girl." So look at this paramedic. Is he an ethical individual because he's eating somewhere where there's attractive women?
I see both sides.
Yeah, yeah. So again, what they say is, obviously, do we have a problem or rule worked out for this? So do we have a rule yet for this? No. Okay, so we're going to go down. Is there an option which will allow you time for deliberation without excessive risk to the patient? This kind of really doesn't apply on that, but
This patient's in an ambulance. Chicken wings.
there's something of a good ethical decision with a patient. How about this? Transfer patient, taking them home, and ask you to go to the drive-thru at McDonald's, pick them up a hamburger. They even got the money. They'll even buy you lunch.
You're opening yourself up to all sorts of trouble.
Yeah, it just looks bad.
It's just like if patients you give them good.
Oh, they have chest pain. Yeah, they're post-MI.
This is like patients that want to give you take them home or something. They're like, oh, here's $10. Y'all stop and get something to drink or something.
Is that unethical?
Yeah.
Well, I mean,
It's like accepting a gift from a patient.
how does somebody else know
Do you tip people?
Do I tip people?
if it's the norm of their
Like
profession though?
waitresses, yes, but
So why
isn't
can't you
there
tip?
something against? Well, I know, because I'm a CNA and I know with nurses and stuff, we're not allowed to receive gifts from patients. Wouldn't that be the same for emergency
That's
medicals?
policy.
Would it be just like, it's like your higher ups said you cannot take this, and this.
I'm
If
saying
it offers you money or something like that, then you
Isn't
cannot
it
take
If
it.
there's no policy,
Well,
and say, let's scratch
if
there's no
That's
policy,
effective.
there's no policy, then.
then, you know, is it wrong?
I mean, you're just opening yourself up personally to a whole. Because now you see, like, if I give you a tip for giving me a chair, and Ethan's like, well, he's going to get better care than me because he's paying. If I don't give you a tip, if he doesn't give you a tip, he may think he's
Yeah, it's a
getting.
one-time event. You know, we're just dropping you off. It's me and Ethan, we're dropping you off, and you give us a 10 spot.
That's
Come on, man. It's a big deal.
I don't see a problem with that.
Yeah. Is that unethical?
I don't think so.
You'd have to go by each person and be a little different. I mean, personally, I would.
I think it is.
Why?
Because it's my duty to make sure that person gets safely to one place or another. And
It
that's
is.
for them. Yeah, but.
I wouldn't take them to McDonald's or anything. I would, if they said, oh,
But you would
we'll
take
buy-
the money.
Take them to.
yeah, I don't know, because it's like, I'm doing
You
my,
won't
I
take
did
them to
my,
McDonald's and buy them food, and they'll buy you food. But you're happy to take the $10
because
bill.
that's off my, like, I guess you see your route, like, okay, my job is to take this guy home. If this guy wants, when I'm leaving, when I drop him off and I'm leaving, if he wants to slip me $10 or something, I mean, I'm not going to say no, but if there's like a policy against it, then yeah, I'll be like, well, I can't accept that, I'm sorry.
Oh, look, I dropped it $5 good.
If there's like some kind of policy or rule, and they're like, do not take gifts or money from patients, I'll be like,
Would
I'll be
you?
like, no.
Hmm?
Would you?
I mean, I don't see anything, I don't say like,
I'm the
I don't-
instructor. I don't have to answer you.
if I went home after taking a tip from a patient, I'd be able to sleep at night. I'd definitely be able to sleep. I mean, now if he gives me like, $1,000 or something, that's kind of
Odd, yeah.
that's a little odd. So I don't think I'd take that. That's a lot of money for taking you home.
Okay.
Should have tried better on that.
All right, we'll play an interesting one here. Okay, let's say you pick up a routine psych patient. You've known this patient forever. Okay, they call up and they said, "Yeah, I sprained my ankle. This hurts. This hurts. Okay, you examine them, you find nothing. In fact, you're so thorough in your examination, you'd make me proud. How about that? It's that thorough. So anyway, this is, can't you give me something for pain? Is it unethical to, there's no injury. Nothing's going on. There's nothing there. There's no injury. There's no deformity. There's no swelling. There's nothing. Even those person sitting there saying, yeah, I slip twisted it and, wrecked it. And for everything that you're hearing, this should have been a traumatic. You should be seeing some kind of deformity of some kind. Something that says there's an injury. He says, well, I need something for pain. We need something for pain.
is he complaining of pain?
Yeah.
Then you
Sure.
wouldn't give him pain medication. I probably wouldn't give him like this strong.
He's a known seeker.
He's trouble.
It's not. They're not your drugs. Though. They're your medical director's drugs.
He's a known drug seeker.
I didn't say
And
that.
prove he's not in pain,
Yeah, we don't give aspirin for pain. Not in our protocol.
unless you can prove.
Oh, maybe a
He's
short
not
dose
paying.
and then leave it at that. It's like, I mean, there could be like those like freak out of the moments that actually, you may not look like nothing's wrong, but something may actually be wrong.
I'm saying there's nothing wrong.
If
You've got nothing wrong except he just says, he just has a complaint of pain. But upon inspection, palpation, every test, motion, no crepitus, full range of motion, can tap dance, on that ankle. And, history of a known drug seeker says, I'm in pain, I really need something.
Wouldn't that be something you have to call for, like medical direction? Like, hey, this is what's wrong with this guy. He says
You're on your own, buddy. You make that decision.
I'd probably, I don't know. I'd probably say no.
I hear a no. Okay.
I'd say yeah.
I just.
You'd say yes.
I'd probably give him something.
You may have to answer to your medical director after that, but
So he might too.
well, either way. But
I mean,
like I said, they're not your drugs. No
Yeah,
harm on your
it's
pocket.
it's your responsibility though.
Right.
Because
But,
this guy's a known seeker. If not, you're enabling him.
but what if this is the one time he is in pain?
But he just said that he, at all costs, he was perfectly fine.
Or
That day-
Yeah, but how do you know he's not in
that day-
pain though? Maybe he heard it, and there's no signs, but he is hurting. Then if he's hurting and you don't give him medicine, then you look like a dick.
I think it's just one of those things you have to explain yourself.
Like to me, you do your assessment and evaluate and document that you got it covered.
All right, especially you guys in the field. How many guys have we brought into? Yeah, I've got neck pain. You put them on the backboard, and you're doing this, and you don't even give them pain medicines, and we drop them off, and they get their X-rays, and they go home.
All the time.
Well, why aren't we taking care of that? Is that ethical not to treat that pain? Or not
Yeah.
treat that pain?
I mean, we don't. I mean,
I'm just saying.
we don't
You're
give the
going-
drug
you're
to
going to
whether.
get-
Yeah,
you're going
in
to
the
be
future,
getting
but
those drugs. You're going to have to make that decision. I'm sitting there saying, yeah, okay, poor Clint there. He got in the car, got a little fender bender in the parking lot. And the guy says, yeah, I've got this neck pain. I put him in the truck. I said, Ethan, have at it. I'm going to go drive. BLS patient.
To me, I would say, I mean, obviously they got in a car accident, they're going to hurt 10 times as bad the next day, no matter what. It's not the same as like little.
Are you
Randy.
going to treat the pain? Should we be treating the pain or not?
I probably would.
I-
That's just me. I mean, like little old granny that has like rheumatoid arthritis or something. And
So
she's
grandma's okay, but Clint isn't. So we're gonna
Because he's young.
We're gonna decide
He's young.
who can,
Ageism.
yeah, we're gonna decide who can take the pain and who can't.
Jesse Jackson's gonna be on you.
Yeah, so you're gonna decide who gets the nitro and who doesn't.
That's a different
You can see a
story.
big tough guy on the outside, but it's a little girl on the inside.
Yeah, or in case it's a biker who's in a traumatic accident and cuts pants off and he's got pink panties on. Laugh now. So she laughed now. Just
I'll
wait.
laugh now, I'll laugh then.
Yeah. No, when you get up there, you're like, you just have that moment of like, this is really here. Oh God. Whatever. So anyway, option available to the patient without risk. Yes, take the option. If no, we start going through what they call the different types of these different types of tests here: impartiality, universality, interpersonal justifiability test. Impartiality. Would you agree to do the same thing if you were the patient? So some people with neck pain would say, yes, I'll give you medication. Some people said, if I had neck pain, no, I'd suck it up. So it changes when it's your neck pain, right?
I don't know. I tried not to complain about everything.
Depending on the severity of the pain. Yeah.
I don't
Yeah.
know. Pain is subjective.
I mean, it feels like a 7 up, yeah, I'd probably take it, but anything probably lower than
You
that.
have to
Probably.
like
And you've got drug seekers,
or
though,
something,
they know how
maybe.
to play that game.
Plus, I mean, the patient's asking for the medicine, obviously, if they would want, you know what I mean?
Okay, here's a good one for you. This is actually a true story. So anyway, you get called to a Walmart. You call to Walmart, it's about middle afternoon, and what happens is you find about a 40-year-old woman, she's actually in the security office, and she got caught shoplifting. Okay? You go in there, and the security's like, yeah, we caught her shoplifting, we brought her here, next thing you know, she's telling you she's got chest pain. Okay? You talk to this lady, she sits there telling you she's got a 10 out of 10 chest pain. It's, substernal crushing, elephant sitting on my chest, I'm feeling lightheaded and nauseated. Diagnostically, her vital signs are stable. She has a heart rate of 80, it's not even elevated. And I'll even tell you this much, EKG is normal.
This regular patient. Have you picked him up before?
This is somebody new. You've never met this person.
Everything she tells you is subjective.
She's just telling you her symptoms.
That's what it is, so it's not.
So what do you do? How are you going to treat this patient?
Give them
You
nitrous.
treat them like you would any other.
Transport. you
Whether
have
they-
to, but we're not gonna.
If they want transport, you transport. Their vitals aren't gonna be enough to give nitro. If her
She's
vitals are
stable.
all stable, there's no reason to give any
She's
medication.
got chest pain. She's 40 years old. She fits the criteria. of having
Give her
a
nitro. Because if she's having
You can give her
if she's
one
having an
nitro.
MI, the nitro will
Yeah,
cure the
I mean,
pain.
you can have an MI with a normal looking EKG.
Say give nitro
Still
because if it's
give, nitro and it's still monitoring vitals. and
Whether she's faking it or not is not your decision to make. If she's making those complaints, you treat as you would anyone else. And if she wants transport, she gets transported and the police.
Because no matter if you
handle her.
transport her or
And
not,
the
she's
whole-
still gonna get
Everything that-
penalized
if
for
your
theft,
assessment
so.
says, everything that I'm showing says.
And you document your file.
So, you're going yes, he's going, well, no. He's saying no.
You can tell the patient all your vital signs are normal. At this point, you want to go. If they insist on going, you gotta take them.
Okay. So
I'm
you
not saying
you're
don't
going to
take
treat
them,
him?
we'll still take them, but you treat.
You still going to be dumping nitro on this person? Dumping nitro, morphine, aspirin?
And they'll qualify for nitro.
I want to kind of see that,
How do they not qualify for nitro?
Because if their vitals are normal,
Yeah.
But she's a
They
woman. She
Qualify
can
for
make
nitro
the
as long
presentation.
as their
But
blood
you-
pressure isn't below a certain degree.
Yeah.
I mean, they can have nitro even if they're like
What's
120
the
over
what was the
something,
blood
as long
pressure?
as it's not.
We'll say 120 over 80.
You got
You
wiggle
can
room.
still,
You can have
still
a
give it to
nitro.
them, right?
Yeah.
It's got to be below 90, but you can't give it to them.
Well, we give the nitro or not?
Yeah.
I'd say
Yeah,
yeah.
I would.
If they,
Okay.
I'd start with
Yeah, just
Okay,
I mean,
you ask
Because
her.
if she is, I mean, let's
Yeah,
just say that she does
start
have
with
that,
that
but
for
for that one chance, that
oxygen.
one, you know, in a million chance
Is
that
Does that
she
help
has
you?
it,
aspirin gonna, I mean, really, is chewing up aspirin gonna help or test me?
No.
No.
she might think it does.
Oh, is that ethical? Are you one of those people that's gonna give like, here, I'm gonna
You're
use something really
muscling?
good in a big, bolus of saline, you know? Is that, let me ask you that, would that be ethical? Even though, if we're going back to our, drug-seeking patient?
Saying you're giving something, but it's not. It's just
Yeah.
regular, just
And then you
Placebo
sit there,
effect.
you get 15 cc's of saline, here you go, and they're like, oh, thank you. Is that unethical?
I don't think so.
I don't think so. 'Cause
Is giving somebody
you can
placebo unethical? I mean, that's basically the same
You're
thing.
implying, but you're gonna, the assumption, you're giving them medication. They're trusting you.
You didn't say that.
Was that
It's
Susan?
something. You might have given them
If it was like that patient where there's nothing seems wrong with them,
Is
and
that ethical? to
they
do
say
that?
they have chest pain, you could try. I mean, I would say maybe try giving them something like that, something that's not really gonna do anything to them. And if they say like, "Well, I feel much better now. Whatever you guys did to me, I feel great now. Actually, I don't even want to go to the
Yeah, but
hospital."
then you also
anymore."
risk the liability if she finds out that all you did was give her normal saline, then now you're in even bigger trouble than what you would have been in if you would have just given her the nitro.
Why are you talking
What are you gonna
about
do?
liability
You're-
if you did not tell her?
But when
It's
you get
medicine.
when you get to the if you do transfer, you get to the hospital, you got to tell the RN, what did you give her and stuff, and you say, okay.
Well, you already got an idea of normal saline established, right?
Right, but whenever what if the patient says, oh yeah, he gave me some morphine,
Yeah, you
and
told
we
the
told the nurse,
nurse,
she said,
yeah, I
they say,
just went and drew up, 15 C's out of the bag. And,
But we wouldn't lie.
I mean, if you're telling them I'm giving you
I'm not
morphine,
gonna-
but
we
you're
wouldn't
giving
lie
them
about it.
saline, that's one thing. But if you're like,
That's what
I'm gonna give you something in your IV, and you don't say what it is, well,
Is that ethical to do that?
No,
You didn't lie to her?
lying to the patient.
No.
You're
if you
not
never
lying, you're not
said
telling
this is
the truth
morphine,
either. You're not telling the truth.
But
either.
you're not
You
lying
are, you
either.
are, because you're telling them you're giving them something. You didn't
You are,
tell
you're
them
giving
why.
him something, but you're not really telling
Yeah,
the
but
truth.
that's still
either.
being tricky, you know?
Just kidding.
Huh?
What's the answer? What is the answer?
there is no answer.
So let me put okay. Now going back to the saline thing. What if you were the patient? Would you want somebody just giving you saline?
I don't look at it that
If
way.
I said
wouldn't
that
be
I
that
had
patient.
10 pain, I mean, whatever.
Yeah, but
I-
you might be picked up by that medic.
But are you going on that we have medical knowledge or not? Because somebody with
Yeah,
medical
you do.
okay, then we're gonna be like,
Yeah.
I know they don't make morphine in pre-filled, syringes.
No, but some places they'll sit there and get that 1 milligram and dilute it.
But you're gonna see. I mean, if you see them do it, you're gonna know.
You really gonna sit there watching while they're going back?
Yeah.
When you go get something back here, you gonna sit there and try to punch your head over a second? Or you gonna be sitting there saying, God, this sucks right now, and just give me to the hospital?
Both.
So yeah, would you want that done to you?
If I ever found out someone gave me some just normal saline, I'm gonna go off the ape shit on them.
Well, what if it works? What if it works?
It's a side effect. It's a vape shit.
I mean, placebo effect does work. Just something. So anyway, moving right along. Would you want this performed in all similar in future circumstances? Anybody looks like potential seeker, non-traumatic, complaining of traumatic pain. Give them balls of saline. Let's see what happens. Let's see here. Have some of
Let's
this.
just roll with it.
Like it.
Let's do that.
But we're not telling him it's not.
The management would know when your consumption of saline flushes skyrockets and they're having to order like twice a month.
No. You just draw it out of the bag and then you just push it right in front of them. You don't have to get this, special flushes. So should we do that in all future circumstances then?
No.
I don't know. I think that's one of those like the situations we're talking about. It's like one of those rare fluke situations that.
What drug seekers are wearing?
No, I mean like the person that's having like I don't know something that you don't know what to do with them. It's like
Just
not
since they're
not
drug
every
seekers
patient is going to
doesn't
be.
mean that a real actual event could not be going on with them.
It's like there's gonna
So
be those,
I would do whatever my protocol says for whatever it is I'm supposed to be treating them for, because that one in a
And
million
they
chance
say,
that it
and
winds
they ask
up.
you, what's that pain scale? It's only a 2 out of 10.
If
Can you
it's
give me
2 out of
something?
10,
Come on, give me something. 2 out of 10.
I wouldn't.
Well, most people
So
legit
wait, so
pain
you got a
ask
cutoff
for
number
payment.
of what is okay, acceptable pain and what isn't.
Yeah, I'm done with that.
Okay, so what if my 2 out of 10 pain is equivalent to a broken bone, and your 2 out of 10 pain is equivalent to a paper cut?
I don't think so, I would have
Yeah,
But if
my
your
10 out
2
of 10
is
pain was when I was hit by a Mack truck one day.
broken bone, then
So
what's your 10? Is it like that or
Huh?
something? I mean, 'cause-
No, it's because it can be very simple. I can remember picking up a SWAT officer one time. He not even subluxed his ankle. I mean, it was a true, closed dislocation. This guy was handling it like a champ. I mean, most people would have been, violently in pain. He was like, yeah. And I remember hitting him with about 10 of morphine. Did that change anything? No. You all right? Yeah. Pain can be very, very suggestive. Huh?
They don't say they're feeling
Because I'm an
pain.
ethical person. Ethan.
They don't say they're feeling that much pain, then why would you go to the max to like cure their pain? Like if they
Aren't we supposed to treat pain?
Because
Yeah.
sometimes the injury will mask, like,
The adrenaline.
But
The
he's got,
sympathetic
Yeah.
response.
I mean, if he's
But
got like
adrenaline
a,
wears down pretty quick
if he's
when
got like a
once you
broken-
slow down.
he's got like a broken
Sometimes,
bone, he's
but
like it's
not
fine,
always.
doesn't hurt that bad. I mean, we still treat him, but like, do you have to give him pain? If he doesn't say he's in pain,
You're the one who's making that decision.
that's what I'm saying. If he says he's not in pain, then
I didn't say he wasn't in pain.
Well, if he says he's got like a 1 out of 10, or he's got like a bone sticking out of his arm, he's like, how
So you're not going to treat that?
If he-
So that's okay.
I mean, I don't
Well,
know.
ask him, do you want, hey, you want some pain meds
I
for
guess it
that?
would depend
No,
on
I'm
the
okay.
severity
What about
of
the drug
the
seeker?
injury.
Yeah, but drug seeker,
That's like-
a
you
paper
don't
cut
ask
for
that.
them is
You
always
don't-
12 out
How
of
do you
10.
know? How
I
do
mean,
you know?
they're always a 12 out of 10, and the person with the broke leg is
This
usually
drug
the
seeker
2 out of
spent time
10.
in a Turkish prison and got beaten every day.
Well, he should have
You
been in
really know
Turkey.
what pain
If
is.
it's like a known drug seeker, it's like different than someone that you don't know they're a drug seeker or not. That example you gave before, if it's a known drug seeker, it's like,
Oh, so the known drug seeker we don't really treat because we're
no, I'm not saying that.
That's cool.
No, I'm not saying
Okay, we're
that.
gonna move
This
along.
is a
Thanks,
no-win
Glenn. You just said,
conversation.
okay,
No, I'm not saying that. I'm just saying, like, if you don't find anything wrong with them, and they're saying, like, well, I heard, it's like, there's nothing wrong with
I
you.
mean, he's got like some neuropathy,
All the drugs.
degenerative disease that we don't know about, and you're just gonna blow it off and say, no, it's no big deal.
I don't know.
That's pretty cool, isn't it? Didn't have that power.
I don't know. Anyway, I'm not knowledgeable enough to answer all these questions. I don't know.
So anyway, are you able to justify and defend your actions to others, Clint?
I will, whenever I make a decision, I will stick with it, and I will explain why I thought that, why I did that.
I'll stand before the man, right?
You know, I'll take my
Yeah,
lashes.
be familiar with these different types of tests and how they work and how you can apply them. So, yes, yeah, it's real sticky. You can get really, really sticky. I mean, there's many times just like, yeah, my neck hurts, this and the other, put them back in the ambulance, put them backward, okay. Everything doing okay? Yeah, I'm doing fine. Thing neck's still hurting? Yeah, okay. We're just doing our business. It's a very, very gray, shady ground sometimes.
If you're ever wrong, you'll find out you're wrong eventually, and then you can correct that for the next time.
Next time it could
If-
be a whole
Well, I
different
mean,
story.
like,
So you're gonna find out when you're wrong when somebody catches you, right? That's what you're saying?
No, I mean, like, if it's like, if it
But if
becomes,
nobody says anything, you're okay, right?
if I think it's right,
It's only wrong if you get caught.
Yeah.
if I think I'm doing the right thing,
No cop, no crime.
if I've run stop signs.
There you go.
So,
No cut.
I mean, if I think I'm doing the right thing, or if I think, you know,
You're not gonna go seek out and
Or
see
you
if
think
that was
you're
the
not gonna
best,
get away
probably
with it?
ethical thing.
I mean, I probably ask about it later on. Like, if you go for a review board, like, why did you do this? And you explain yourself, like, well, you're wrong. Just like, no, you're wrong. You're dead wrong. I'm like, okay, I understand now.
No.
So,
I guess you gotta take it, learn.
He's
I mean, like, if you go up there and you're wrong,
Yeah, guys kind of roll with it. So anyway, other issues. Val DNR is present, but patient is breathing and have a pulse. 90-year-old man. He's in a nursing home. You go check him out. He is very, very febrile. He is just, I mean, he is so hot to the touch. You could drop an egg and cook it right there. He's breathing probably about a good, let's say about 12 times a minute. His lung, when you listen to his lungs, you hear bronchi all over. He has no radial pulses, only brachial. What are you gonna do for this guy?
We're gonna treat symptoms.
Could give them oxygen
Okay,
and supportive care.
he's dying. Why are we screwing with this? Why are we?
It's
You-
not-
you can
it's
treat-
We
not-
just want
you
to make
treat-
him comfortable, just because DNR, he doesn't want to be resuscitated if he were to, I guess,
We're not making
die
him
in
life.
front of us, but
Try to
he's
bring-
living,
try to
there's
make
no
him
reason why
better
we
so
can't
he can
treat
live.
him.
Just make him comfortable so he can pass away.
Yeah, that's that bank of my some guy I was talking about. Yeah, I had an individual tell me, he said, "Why are you doing this? They got a DNR." And I said, "He ain't dead yet." Yeah. Then the person asked me, "Do you want a medic or EMT?" I'm like, "How about a driver?" Don't learn from my example. Some days it's probably not best. Family conflicts in the presence of DNR. Grandpa wants to die. I mean, he's 110 years old. He is tired of this place. You know, everybody else doesn't want him to die.
It's
You know,
like
it's
patient's
just
wishes.
I mean, get
Patient's
this really
wishes.
document. Because really,
Yeah, that I think that's actually probably pretty more. I mean, the DNR is pretty, you know, pretty clear and dry on that. What about terminating resuscitation when efforts appear futile or valid DNR is not present?
Comes at a time whenever you try and all of a sudden it's just not working.
I mean, what's the DNR's
Call.
It's gonna be hard to do, but I mean, you have no choice, you have to.
Because that's a fun game we always like to play, and especially when you go for interviews. They're going to sit there and say, "Yeah, I got this. Well, I'm going to call the medical director. Medical direction's offline. I'm going to call the helicopter. It's a sunny day. They're doing PR. What are you going to do?"
Transform the hospital.
Yeah,
Well, I
try
mean,
to
it
get there, try to
It
get
says the
there.
DNR
It's
is
a
now
DNR station.
presented.
You got.
Oh, and
You start working as patient. DNR, you know, is now.
and then it's presented.
Yeah.
But then you stop your life-saving techniques and just
But you
Put oxygen on them
and
and-
that you already committed to resuscitation efforts.
Yeah, but then now the DNR is presented.
We started the treatment and like resuscitating, you know, and there was no proof that there was a DNR, but now that the DNR is present, we just, okay.
How about you
now
save
it's
his
here.
life and
We
then-
have a legal piece of paper telling us that, you know, we have to stop
Yeah.
resuscitating this person.
Yeah, that will happen. This will happen.
You couldn't say that. You couldn't save the guy's life. Like, well, you can get it next time.
what are the legal
What if you
implications?
come walking in there, grandpa's dead, family sits there and says, "He told us he wanted to live." And
If he has a viable DNR, then we have
But
to.
grandpa told before you guys came here, he said he wanted to live.
That's
Truly
his-
did, or they saying that?
They're saying that.
They're saying
Grandpa's
that
dead
this-
right now. He's
this-
dead.
Oh, there- well,
There's a written
you
document
can't go,
saying.
you
I
can't- you
didn't hear
can't go off
grandpa.
of what the family members say, because family at that time,
There's the last witnesses.
But yeah, but it's not.
but they can say stuff.
It's not what you know. It's what you can
But
prove.
Yeah, but once grandpa
it's
comes
what they're
back-
wanting, it's not what he would want. We don't know that.
You don't know that.
That's right.
That's where you have to.
So because grandpa wanted that, then the DNR is invalid.
Right.
So you're getting this is now second party information.
So what do you do?
But you
I don't
can't
know what you
prove.
do.
I would say.
I
You
would
put in
call,
the
I'd
situation.
probably call medical director.
I would just go off the DNR. I'd be like, well, this is the only written document, unless you
Oh,
record
they
it.
go to court,
That was
also,
tough
you know, the
because-
law firm of Dewey, Scrum and Howe contacts you and says, you know, well, thanks for terminating, I'm glad you wouldn't follow that legal document, but however, we have 5 witnesses that state that grandpa said, yes, I want to live, at which, you know, invalidated that DNR, therefore, you know, we can hold you, you know, for neglect for withholding treatment.
In court, would their
There's just a number of
would their
things.
testimony like would that
What
be
is-
valid?
Why not?
You would ask that
But there's
prior,
a-
I guess, would you ask the family?
What are the legal
Can you get
ramifications if somebody has a DNR and you still work them? I mean, is there a law that says then?
Mhm.
The legal document.
I mean, well,
Would it be considered assault and
It could be called assault and battery, we could put, you know, put a few things in there really, because you're actually forcing treatment.
So do you
guys
just
have fun
go
now?
in there and be like, hey, before he went unconscious, did he say he wanted to live?
He says, yeah, he said, yeah.
So then
All
he-
5 of us here said yes.
but there's no proof of it.
Yeah, that's what I'm saying. That's
There's no
what I'm
proof
saying.
he did or he
All of us are
didn't.
liars.
You have to
All
go-
the family members are now
You
liars.
could be.
So
I mean, there's
you're-
no way to prove it
you're-
either way.
So you're gonna say, you're gonna
And that
say
could be your feeling.
No,
but
but-
it
Go-
is.
go off.
In my head, I would
I
say
think I
that,
would
but
try my chances, but I would have all the family members, maybe like in my report or something, but each family member had stated that, you know, whatever, maybe half a family member.
Or
The
you
family
sign
member
something.
signed
And-
my
That way, if grandpa
documentation.
gets mad, it's back on the family because you've got all those witnesses.
And my
all the
grandma comes
witnesses.
back and says, what the hell were you guys thinking? My
Your
family was just
family's-
freaking out.
well, your
Now I'm
family's
alive again.
thinking-
And then they'll sue you
It
anyways.
won't last long.
Yeah.
And they'll sue you for bringing it back to life.
Lawsuit process.
So what would you do in that situation?
Huh?
What would you do in that situation?
I really don't know.
Thanks.
That's awesome. It gives me something to think about for the next 16 months.
So basically in the test, you can't do that.
Honestly, that's a very, very, I mean, you'll run into family members, but it's very rare.
You're not going to put these scenarios on the test, right, where there's a no-win
For you,
situation.
Yeah.
But you can't get them wrong.
It's not, there's no right or wrong answer, it's how you justify what you did and how you back yourself up, is really what all this is coming down to. Because yes, some people say, you know, I might come in there, I mean, I can tell you one time, we had to do a 45-minute response time from Jonestown around the lake, going down to Valente, and we got their patient's cardiac arrest. Okay, well, they've been down 45 minutes. Okay, when did brain cells start dying? 39 minutes ago. You know, we get up there, and they're, you know, our partner's like, well, the person's dead. You know, we worked it. Well, here's family. You know, big glossy eyes looking at us. I'm like, no, let's just work it. At least make them happy. Even though you know that there's no possibility.
Did you get in trouble?
No.
Really?
Again, the stuff I got in trouble for where it was mind-boggling. I'll say that much. I never got in trouble medically. Somebody tried to get me in trouble once. That was kind of funny.
Maybe just like you over it.
No, you really don't. See, that's why I hound you now, Ethan. So anyway, confidentiality, state laws, the greatest good. Basically, if you look at it this way, if you ever run into those really, really tough situations, just go, again, err on the side of caution, and what is would be the best interest of the patient. That's really the best you can do. What would be in the best interest? And like I said, you have to document it. You know, some people might agree with you, not agree with you. So consent, competent patient refusal. Patient has legal healthcare decision maker refusal on specific therapies. So that's pretty clear. What's true parity? Are you guys online there? Actually, that is from Oklahoma. Yeah. Little Timid Bay.
Is that a baby kid?
Dead. Dead baby, actually.
Does it burn all up? I can't see it.
Hmm?
Does it burn?
Oh, yeah. That's actually kind of an interesting thing, but, you know, because we get those, you're going to get those calls where kid is dead. You come walking in, kid's dead. You know, what do people do when they see, you know, a dead child?
Start throwing them at medics.
Huh?
Throwing it in
Like,
the hands?
take care of it.
Here.
Yeah. Yeah.
Flame and baby
do
syndrome.
something with this.
They're blue and
Yeah.
something called.
Allocation of resources. True parity, need, earned, and special. You kind of think of more of this as kind of that whole, especially with this, you know, think of that whole triage situation. I mean, you know, I mean, yeah, we've got this criteria that says yes, you go, no, you don't, but they're not always that clear cut. You know, sometimes you have to make a decision, okay, yeah, you're breathing maybe at that borderline of like 10,
Yeah.
you know, but, you know, these guys over here may have a chance. We could put you there, but it puts these three behind. You're not really black, you're not really red. You know, how do you make that cut?
You got
Well,
to
it goes on to try to save as many people as possible. And the ones who have a better chance of surviving, you do pick. So what makes it, like I said, you got that guy that's right in the middle there. Do we take care of him or not take care of him? Depending on the severity, because I'm telling you, he's right in the middle. Right in the middle. Yeah. You don't have enough ambulances either. So it's where this gets really frustrating. So, you know, because I mean, and a lot of times, what you'll run into is whoever's out doing triage will do all this triage, then you get a treatment, and then they'll reclassify him. Because, you know, obviously they got a whole different setting, they kind of probably look more in depth and whatever. But sometimes it's just kind of sit there and say, you know, yeah, guess what, you're 10 years old, I know you're breathing 8 times a minute. I've got grandma here who's 90, and she says she has chest pain from this, you know, her event, and she's talking. you know, grandma's red, you're about to go black, but who's actually going to live? Who would actually be able to survive? Child, probably. Grandma may not, you know. I mean, she's.
And that's what I would say to the kid because they're younger or
Yeah.
really.
What was their triage scheme say? If you're, you know, you fall in that black, we're going to leave you there to die. I mean, that's one of those things. I mean, we really don't really confirm, but you know, with the triage, we are going to determine you get to live, you don't. This is your last breath. It's. So anyway, provide obligation and to respond to care of inability to pay when seeking emergency services. How do we handle that?
Handle.
I mean, it's taking that frequent flyer that calls up for, you know, feeling nauseated and depressed for the umpteenth time, pulls an ambulance out of service, you guys are tapped. That person has racked up $1 million of unpaid debt.
My thing was like start taking away their food stamps and stuff like that.
This person isn't on food stamps.
Or you know, I'm just saying most of them are on disability or something like that. Take that away if they are.
Should you? Are they mentally competent? I mean, if they're calling 911 all the time, are they mentally competent?
Well, that's for law enforcement. They can pull their medical records and review it, and if they are abusing the system.
What's law enforcement going to do? How's that law enforcement involved in a medical social decision?
We've had them before on, you know, the ones that call like every day to subpoena their medical records to see if they actually are having medical problems. I don't know what they do after that, but
yeah.
I mean, I don't know, they fine them, put them in jail. I mean, I don't know if they do that, but they have done it.
So you're gonna run into a lot. There's gonna be a lot of people that are. There's a lot of system abuse out there, and it's like, how do you manage that? Because they're gonna say, "Oh yeah, take me to the hospital." In fact, the person I was referencing actually got to the point that they could not step on the grounds at South Austin Hospital because they had a no trespass from work because they kept playing this game. So of course they'd start calling us and all this business, and I remember at one point I was just, you know, this person's like, "Oh, I got this, you know, I got this adult." It's like, "Really?" It's like, "Well, I'll take you to the closest, and that's South Austin." "Well, they'll arrest me." It's like, "No, actually, if you have a legitimate complaint, there's no way they can hold that warrant to you. That no trespass warrant." You're like, "Well, you don't understand. They'll arrest me." If you have a legitimate complaint, let's go. Person backed out of that really quick. So I mean, but they're out there. They're out there. I remember there's this one guy. His name was Roy. Never mind. I was supposed to say that. But yeah. Oh, I'm gonna have to work that out. But this individual called for tooth pain.
Yeah.
You know, had to go to the hospital. Ran out their Medicare funding for taking an ambulance, and actually racked up $1 million in unpaid bills.
So who pays that for everyone dies?
No one.
Is that just
Well,
government does?
actually, we all do.
Oh, you start
Taxpayers,
We
when
all-
your rates go up, when insurance goes up, when the hospital charges go up, all the testing goes up,
Yep.
it all gets filtered back to the consumer.
And they can't put that in your credit report either, can they? Because medical bills can't be held against your
It's
credit.
in your.
Well, if he's got $1 million in
it
bills, he
does.
probably doesn't even have credit.
But it doesn't.
Or should-
Well, in fact, I mean, come on. I mean, this guy's probably not too concerned about his credit. He's
No, I was just asking, like,
Why are you thinking about racking up $1 million?
I'm thinking about it. Tell me what the right word is.
While you work, then move somewhere outside the country.
It's all about the middle district.
Get on a boat and go.
What happens if you don't pay your bills, don't you?
I'll tell you a story about that later.
Okay.
And we'll talk about ethics. But this is one of the, off the record kind of. But this, as I said, yeah,
Okay.
a little Denver general story.
Like, if you can't pay your bills, don't you get in some kind of like legal trouble for that? Or?
They can't put you in jail.
It's in the collection agent.
They
but,
send it to
I
a
mean,
collection agency, and the collection agency will work you to death.
Yeah,
But it doesn't
They
necessarily.
can't even garnish your wages in
Yeah,
Texas.
no.
yeah. I
They
mean,
can get a judgment against you, but they can't. I mean, is it worth it to them? Unless it's $1 million,
Are
and
they
then if you're
able
not
to
paying, you
send it
probably
to
don't
a
have any money anyway, so
collection
it's
agency
worth legally
considering
pursuing.
it is medical?
but they can't force you to pay it.
Anyway, we talked about our IV drug user, and okay, mandates of medical insurance provider. Other insurance, like Blue Cross Blue Shield of Texas says, I only want you taking people to Seton hospitals. No St. David's. Even though, let's say St. David's is the trauma center, closest trauma center, Williamson County.
The treatment that they need if they need treatment at a trauma center, that's where you should take them. You need to take them to the facility that can give them the best care.
Here's a real
Unless the patient
Closest
says,
to most
no, I don't want to
appropriate
go there,
facility.
you know, if they have a, but
They can request where they go too.
This is a true story. Guy, hypoglycemic, has hypoglycemia issues. Mike calls, we come out there, we give D50, right? He says, okay, give D50. He's learning oriented. He says, oh, so you want to go to the hospital? He's like, yeah, I gotta go to the hospital. Okay, what happened? Give sugar, usually okay, right? Getting around and it's like, you sure? I'm like, sure you want to do this? He's like, tells me straight out, last time I refused, my insurance company wouldn't cover this. They charged me $800. If I go to the hospital and go to the ER, they'll cover everything. Now, is that ethical? I mean, that's one of those things. I mean, ethical for the insurance company to do that. I mean, really, they're willing to sit there and pay, you know, the ambulance ride, the ER, the physician, and all the other things. But they sit there and say, yeah, we come out, we give them some sugar, da 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 da. They don't want to even deal with that $800 bill, but they're willing to rack up the $2,000, $3,000. So I mean, that's something that's, you know, I wouldn't be surprised if they're would try pushing. I hear like Kaiser Permanente up north. They really try to push that because they want you to use their ambulance. Like if you have an emergency, you call our ambulance that we're contracted with, not 911. You contact this and go to our hospitals because they've already got these little agreements ready. So you got to be careful of that stuff. So responding off duty when not prepared or when others are now placed in potential danger. I think we kind of talked about that already. So, teaching, should students be identified as such to patients?
Yes.
Yes? You don't think that would freak them out? Yeah, this is my student. He's going to stick a tube down you nighty-night. As you're going under.
You won't remember when you wake up.
You know, last thing you hear going out. I mean, do you think that's fair? Would you really want? I mean, really, would you want to hear that? By the way, this is a student. He's going to be sticking. This is his first time sticking a tube down and a throat, and it's going to be yours.
I think as the patient, I wouldn't want to know. So.
Well, at least you told them the truth that you were
Yeah.
going to do it.
So we tell the patient at that point.
Good luck.
The policies in place.
I'm not asking about policies. I'm asking you to make a decision. Make a decision. Make a decision and run with it.
Well, you could ask him to make sure he thinks he feels important, and then when he's out, he's
Well, if
out.
you're going to hard time, I doubt you're going to have time to have a conversation
Yeah.
about.
I'm saying this. I'm talking about this in the OR.
Well, you have to introduce yourself as a
Yeah, as
student.
the student, I would want to
You're
introduce
being
myself.
wheeled in. You've got the surgeon here. You got the anesthesiologist here. You're there. Everybody's there. And you said, by the way, scoot on the table. Okay, yeah, okay. You know, do you really want to know? It's like, guess what? You gave me cabinet done today, and guess who's going to be practicing their first innovation down my throat? Do you really want to hear that information? Should we tell them that? Not tell them that?
Well, if they're at a teaching hospital, they should already expect that some sort of student is going to be doing something on there.
Well, some people
I don't think a lot
But
of
they
people
also
know
have
this.
the,
Not all
but
hospitals are
shouldn't you
teaching
tell them?
hospitals.
Because if they don't want a student doing enrollment, that's their opportunity to say, you know, I prefer, you know, a professional.
Ideally, but something like not all hospitals always teaching. I mean, they might be just contracted to go use the OR because, hey, that's the only place we have available. We don't have a teaching hospital like Scott and White. You go down south, they don't have, Brack is probably has now converted itself to the newest teaching hospital in the last couple of years. But not the word getting down there.
Do they have to let the patient know ahead of time that this is a
I'm
teaching
not saying-
hospital and
I'm saying
students?
should we? Should we? But,
They've got the right to at least know.
Yeah.
That way they can maybe choose a different hospital if they so desire.
I think
Ahead of
they
time,
should
not
write
while
them
on the table,
down.
like, let's forget this.
I would say it would be the patient's first time. Just be like, the student's going to be the one performing whatever today.
You're not telling them they're a med student, EMT student, medic student, nurse
so
student.
how far does the teacher allow the student to practice unsuccessfully without intervening?
Yeah, I would say once.
You know? Oh, Russ here can't get IVs to save his life. How often are we gonna let him stick people? At what point do we sit there and say, Russ, it's time for you to get away?
I guess it
Stop
depends on what it is that they're attempting, depending on like the severity or like whatever. It's like
If in general, if in
like
general,
IVs, like once or twice, if not, if you don't get it by the second time, get my way so we can get this line moving.
How about this? You're the preceptor, you got a paramedic student, he's here, you can do IVs, all this other business. He's very nervous about doing IVs in the truck. He's gonna do an IV on a patient, he does this. What do? You stop him? Or do you sit there, do you let him try it, or?
No, I would stop him for that time. I would take over that patient,
Yeah.
but when you have the next patient, well, I would take over if I were teaching it, and then I would show him, you know, how it should be done, and then the next patient that we pick up, let him have to go around again, and let's pray to God he doesn't.
But how do you warn him? Maybe that might have been the only IV for the day.
if he's going like this, no, I'd stop.
Actually, that's again true story. It's kind of funny. Like,
Because I mean, the
stop.
possibility that
I'd
that person
stop.
could have injured the patient more than was the way he was doing it. So it would be the, you know, not the student, but the
I'd fall back on.
I mean, the preceptor should be talking about all the interventions anyway. You know, if you did it good, talk about the good things.
Well,
every
that's
time.
That's the easy part. I mean, the thing is like, well, I mean, what if you're just, you know, like I said, you know, you're doing IVs and you just can't, you're having bad luck with IVs. I mean, at what point do we sit there and say, hey, we got to pull you out? You know, what point do we sit there and say, okay, wait a minute here, you know, we're going to let you innovate, but instead of say, okay, well, wait, no, we got to stop you because you're cranking on the teeth or you're in there too long, or, I mean, where's that leeway to let you play and learn versus, I got to get you out of the way now? See where that kind of gets a little fuzzy?
It maybe had to be whoever can do perceptive. Would be different people have
Preceptor's precaution it is.
number of times.
Yeah, it is.
Yeah. It gets very subjective. It gets really subjective. And that's, you're kind of finding out with preceptors all can have a little bit of, you know, again, they're going to have their own ideology of how much we're going to let you go and how comfortable they are with you and how comfortable they are precepting. Like if you precepted and taught for a while, you're probably going to be a little bit more relaxed versus, you know, hey, I'm a brand new preceptor, you're my first student. I mean, you're wound just as tight as a student is that day. Is a student always a student?
Yes.
Yes.
Professional relationships. Your EMS directors ask you to try to obtain refusals for those who clearly cannot pay. I'm tired of taking, you know, it's doing damage to the system. We cannot do this. Some of this seems pretty clear, cut and dry. Ask you a harmful dose? No. I mean, because the liability comes on you. The thing is, probably we really need to talk about is the keyword liability. Where's the liability really going to fall on in some of these situations?
You.
The provider.
Yeah. I mean, because like I said, can somebody legally ask you to do something harmful? Or command you to? Can police sit there, come by and say, yes, here's a gun, I want you to shoot that? They can't. Nobody can legally make you do something harmful, so. Your partner suggests administering a high dose of morphine to a terminal patient in order to end it. Patient's a cancer patient. Terminal cancer patient in pain every frickin' day.
No.
Just that little extra push is gonna.
Yep. It's considered murder, no.
Kill that person.
I know somebody who actually had a big ordeal over this. He went. There's a guy in Austin. He went to the military, and he ran this situation a couple times. And what happened was that these patients were terminal, and he was dosing them up. Air Force didn't like that too much. They kept trying to come back on him, saying, "Well, you're falsifying documentation. You're doing this. This is attempted murder." Da 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 da. Actually, it turned out he ended up getting acquitted of everything because no doc wanted to come up there and say, "There is a limit on how much pain medication we need to give to a terminal patient. We are not going to do that." And that was one of the big defending points on him. They said, "No, we're not. You can't do this because we sit there and say, yes, you have cancer. Well, you need X amount." especially when you can build a tolerance to pain medication, or, you know, if you get more and more pain, you're going to need more, so. Your EMS agency wants you to deliver a clot-busting drug as a part of the research trial, but the patient does not have to provide consent. That's a tricky one. How do we test this drug?
But then you say that like last time, like with
Yeah,
the
like how they do with
squeezer thing, like we kind of EMS had like a loophole on that stuff.
Yes, yeah, for emergency situations, but I mean, here you got a guy that's complaining of chest pain, and we got a drug
Didn't
that,
say you complain of chest pain.
what do you think that clot-busting drug is going to be used on?
Can it help get rid of
Chest
the
pain.
clot that could be using
Yeah.
chest pain to help prevent them.
So,
I mean, would that not be an emergent situation if you had to?
I don't know, at what point do we call it emergent?
When the patient says.
Okay, now I've got, again, we got the 2 out of 10
I
chest
guess it
pain.
would depend on, like, I guess, like with the EKG and his vitals and all that other stuff would stay.
So where do we draw the line?
I guess you either use it on all or none.
I guess it depends on how the research is set up. How whoever is
Yeah,
starting.
that's a tough one. I mean, it's like I said, when they're dead, you know, or they're dying, truly dead. I mean, what have you got to lose at that point? If they're conscious and alert, saying, you know, sweating bullets and having chest pain, do you want to have them sit there and say, do you want to try this controversial medication we're experimenting right now? Da-da-da-da-da. What do you think they may say? Yeah, go right ahead. You know, that's a tough one. Oh, this is pretty self-explanatory. Here's a big liability issue waiting to happen. So anyway, ethical issues are seldom easy to resolve. There's often no easy right and wrong decision. So we just try to attempt to foresee, discuss possible solutions earlier. I mean, that's all you can do, is try to sit there and say, you know, how are we going to deal with this when it comes?